I think the department is unique in that it covers every subspecialty in urology with extraordinarily talented people who are really bright, great surgeons, and take great care of patients. In addition to that, we have a very dedicated office staff of nurses and support personnel that make this a great department. We've done a lot of work looking at microRNA and looking at biomarkers. These are going to be applied to other aspects of urologic cancer, certainly prostate cancer, the new developments using ionizing steam for treatment of prostate cancer in terms of focal therapy. All of that, plus many, many other things that are available to us in the greater Boston area, which is a hotbed of biotechnology and medical device development, and be able to meld those research activities into clinical care.
Focal therapy is important because it gives men another option. What it is that we are now able to see areas of cancer in the prostate, and we would like to get rid of just the areas of cancer and leave the non-cancerous areas alone. In this regard, we're able to actually maintain quality of life, which means really potency and continence, and some of the other side effects associated with the traditional treatments that we're offering men now.
Some of the greatest advances have to do with molecular biomarkers in the diagnosis and treatment of bladder cancer, as well as targeted immunotherapies. When we first discovered that N-cadherin is aberrantly expressed in high-grade bladder cancer, since we published our findings in 1998, N-cadherin has been widely studied as a clinical marker of bladder cancer progression. These biomarkers can be based on tumor suppressor genes, DNA mutations, mRNA, microRNA and cell-free urine, and even metabolic markers in urine.
The development of flexible ureteroscopes and the more recent development of improved visualization with digital scopes and fiber optics have provided increased chances for stone clearance with single procedures for patients with complicated upper tract kidney stones.
BPH, which stands for benign prostatic hyperplasia, is a condition that affects the majority of men to some extent, and there's been an evolution in different options for men over these years. We now have oral medications that can attenuate the symptoms, which work well for some men, not for everyone. We now offer even less invasive things that we can do in our office. There's something called UroLift, which is a placing of a suture with little anchors that distract the lobes of the prostate so the opening is better, which sometimes is all a person needs. We have a procedure called Rezum, R-E-Z-U-M, where we inject steam into various parts of the prostate that cause ablation of that tissue and shrinking back of the prostate to relieve the obstruction. And these two new ones are exciting because we can do them in the office without hospitalization with just local anesthesia.
My work treating your neurogenic bladders recognizes that bladder function is a combination of nerves and muscles and how they interact. And as a urologist, there are a number of conditions that present and that affect the bladder from a neurogenic, meaning from the nerve supply perspective. So I offer a wide range of services that address the neurogenic function of the bladder that range from pain to emptying to urinary incontinence. Anything that addresses the function of the bladder, we provide as a way to address that neurogenic bladder. This has been a really enriching experience for me thus far. We have a wonderful sense of collaboration, collegiality between the urologists, and we have an awesome staff that really are committed to teamwork and making sure that the experience for the patient is top-notch.
I think the future is extraordinarily bright. The growth and development of the department is such that we have exceeded every expectation that we had and that the hospital had for our growth. We've become a department which is a destination department in that now many of the patients come from out of state. The respectability of the department is enhanced by the character and nature of the people who work here, as is their interest to do cutting-edge research and translate that into clinical care.